course, we're going to start with the newborn, and we've had our newborn material, and you've seen newborns when you were in your inpatient setting. And so now we're going to look at the feeding and the care of newborns. And we know that it fosters optimal growth and development. You have to have fuel for growth, and so we want to start developing those good eating habits right from the beginning. And even though you look at a tiny baby and you're not thinking about this child becoming overweight or obese, yes, even how the child is fed in infancy can have an impact later on in their life. Now, I'm not saying babies need to go on a diet, but again, fostering healthy eating habits is so important. So we're going to start, of course, with the American Academy of Pediatric recommendations. What the AAP, the American Academy of Pediatrics, recommends is for the first 6 months, optimally in the ideal world, that babies are exclusively breastfed for the first 6 months, and that moms continue breastfeeding up to 12 months or beyond. And again, that depends on the comfort of the mother and the child. That's totally on them. But if we can get moms to breastfeed exclusively for those first 6 months, what a great beginning. If we do wean those babies before 6 months of age, we really do need to use an iron fortified formula to replenish the iron stores that mom gave the baby in utero. Now, those iron stores, by the time the babies are about between 4 and 6 months of age, they're starting to get depleted. So we may be looking for other sources of iron, and we're going to talk about that when we talk about the introduction of solids. So what's the when you're looking at breastfeeding, there are cultural influences, and there's some people who immigrate to this country who think that breastfeeding makes them look primitive and that bottle feeding is a whole lot more modern, and they see this as a way of adapting to American culture. So that's one thing that you want to kind of look at. There are lots of benefits for breastfeeding. It's specially designed for human nutritional needs. It's human milk made for humans, little humans. It's always available and at the right temperature. It helps to mature the baby's GI tract. It passes on specific antibodies and cell-mediated immunological factors. It decreases the baby's risk of sudden infant death syndrome. And it's a whole lot less expensive than buying formula and all the apparatus that goes with bottle feeding. So we also want to look at the feeding cues to show that baby's ready to feed. Well, some feeding cues we may pick up on is that the baby is putting his or her hand to his or her mouth. They're rooting, they're mouthing their fist. Another little thing to note is that babies do have an extrusion tongue reflex. It's one of those primitive reflexes. And that's one of the cues that we use to assess their readiness for solids. If it's present, the baby pushes food out. And it typically disappears somewhere between 4 and 6 months of age. And I always tell people it kind of looks like when you put a spoon near the baby's mouth, it kind of looks like a little snake, their little tongue kind of darts out. And that will disappear when they're ready to start eating solids. So that's something to keep in mind. So we're going to look at the nutritional needs based on all these different factors. Yes, we need lots of fluids, and our fluid requirement for the first 2 days of life is about 60 to 80 mils per kilogram per day. Then from days 3 to 7, we need about 100 to 150 mils per kilo per day. Then days beyond that, we need to increase our fluid to about 100, from like days 8 to 30 to 120 to 180 mils per kg per day. As far as energy, human milk contains about 20 kilocalories per ounce, and the fat is the greater amount of the energy, but it's specially designed fat for human babies again. And so they try to make formula the same. Now it's interesting because they've reformulated some of the formulas, and the standard thing was always 20 calories per ounce. And now they've kind of kicked it back to 19 calories per ounce, again, in hopes of looking at obesity. And there's been studies to show that the formula is not going to have an adverse impact by decreasing by 1 calorie per ounce. But that's a concern that some pediatricians have voiced. An important thing about carbohydrates is that, you know, it's milk sugar, it's lactose, that's the milk sugar that's in the milk, and the fat needs to be very, very easy to digest. That's an important thing. As far as protein, breast milk is a lot lower in protein than unmodified cow's milk. And this is important because babies' kidneys are not mature, and if we feed babies cow's milk before their body is ready for it, we can actually cause a whole lot of problems. And again, their kidneys cannot handle it. We can also cause GI bleeds if we go and feed them unmodified cow's milk before they're ready too. So their gut just really isn't ready for it at all. Cow's milk has more casein, where breast milk has more lactoalbumin to the casein ratio. And lactoalbumin as a whole is a whole lot more easier to digest than the cow's milk casein that you're seeing. The vitamins, human milk contains the vitamins that are necessary for the development of the baby. And the one vitamin that we can't really get in breast milk is vitamin D. So we say, you know, expose the babies for about 30 minutes a week in a diaper to some indirect sunlight. We don't want the babies to get sunburned, so, you know, placing them in a bassinet in a sunny window, and 2 hours a week if clothed. Minerals, cow's milk is higher in mineral content. Breast milk, the calcium and phosphorus has the ideal ratio, which is 2:1. Iron is better absorbed in breast milk, and the vitamin C and lactose facilitate the absorption of iron. So now we're going to look at breast development. So there's all kinds of different things that play into the equipment needed for breastfeeding. So we have the lactiferous ducts in the sinuses, the hormones that are necessary to produce and release the milk, and then of course the delivery equipment itself, the nipple. And sometimes the nipples can have issues. It can be erect, which is what we like, or it can be flat or inverted, which makes it more difficult for the baby to latch on. So here's just a diagram of the breast. Now, here's a caveat. It's not the size of the breast that matters, because big breast, little breast, that's not what matters. It's having the ducts, having the alveoli, having the equipment that helps to store the milk and deliver the milk. That's the important thing. So here's just a quick diagram of all the different structures that are in a female breast or in a male breast that facilitate human lactation. So when we look at the composition of breast milk, we have colostrum, and colostrum is that early milk, and moms start producing that colostrum during their pregnancy. It's very thick, sticky, compact. I would say it's kind of like condensed milk. Compact in calories, kind of gets the babies hooked. You know, babies like the sweet, and it's full of antibodies, which is really great. Then we have the transitional milk, as the milk is starting to come in, as mom is the whole mechanism with the baby latching on and milk production's ramping on. Then we have our mature milk, which is what that's the type of milk that moms make once lactation is established. Now, the interesting thing about breast milk, it has foremilk and hindmilk, and the foremilk looks more like skim milk, kind of like a bluish watery, and the hindmilk is more like cream. It's more fat concentrated, so it's more satisfying. So the foremilk gets released first, and the hindmilk is the last bit of milk at each sitting that gets released. If a mom pumps and freezes or refrigerates her milk, she will see that it will separate into like the cream and the which is the hindmilk, and the more watery stuff, which is the foremilk, and it actually does separate in the refrigerator or freezer. It's very interesting to see. There's all kinds of different positions for feeding. And we want the moms to be comfortable. We want the babies to be comfortable. And the football hold, just if you've ever watched anyone carry a football, they kind of have the football tucked under their arm, and that's basically that position that you're seeing in that upper photograph. That's a really nice That's a really nice hold for moms that are C-sections or have had a postpartum tubal ligation, or just to kind of give a little alteration. I tell moms that it's real important that they try to alter where the baby's latching on their nipples, so that the baby's not latching on the same two spots all the time, that they kind of think of themselves as a clock and kind of rotate the baby around so that we don't get too sore in one particular area. The cradle hold is that typical where, the baby's kind of cradled across mom's lap. And moms can also nurse sideline when the baby's just kind of lined up with her as she's laying on her side, so the baby's head's facing where her head is, and the baby's feet are facing where her feet are. Okay, you're going to see here latching on is real important, and we want the nose, the cheek, and the chin to touch the breast. Mom should say there's no pain, and so it's really important that the mom doesn't just get the tip of the nipple. We want her to get the whole areola, because the little diagram that you see there, that grabbing that areola, that sucking stimulus, gives rise to the production of prolactin. And prolactin, it's an anterior pituitary hormone. Prolactation, sucking stimulus, and that's going to help with milk production. So proper latching on, number one, is going to help with milk production. Number two is really going to help moms not get sore and not get frustrated, because if you don't latch on correctly, you're not going to stimulate correctly, and you're not going to be able to release milk correctly. It's also important too that moms break suction when they're going to take the baby off to burp or change breasts. Don't just pull the breast out of the baby's mouth, because babies really are like Hoover vacuum cleaners. Even if you think that they're sleeping, they may not be totally off the breast, and as you're withdrawing the nipple, they may clamp down, and that can be extremely painful. So how do we tell moms to break suction? Just to take their little pinky and put it in the corner of the baby's mouth, between the baby's gums, to release the suction, and then they can withdraw their breast without difficulty. So again, we have to make the milk first, so we have to get that baby latched on correctly and suckled to stimulate that prolactin level. All part of the feedback mechanism. So again, as we keep looking at our breastfeeding, yes, you have to make the milk, then you have to release it, and that's what letting down is. That's the releasing. So our prolactin has made the milk, and that's in our anterior pituitary, and our oxytocin, that wonderful oxytocin that helps moms labor, that love hormone, is what helps to let down and release the milk. Now, let down is a really kind of an interesting sensation. The moms will feel a tingling in their breast often. Often as they're nursing on one side, milk is releasing from the opposite side. Early in the lactation process, while mom is still in that postpartum period, she may have uterine cramping. Again, that's the action of oxytocin. So this is actually doing mom a favor. It's helping to make that uterus contract and shrink back to its pre-pregnant state. So she may also have an increase in the lochia as she is nursing. Feeding schedule. No, we don't whip out a watch and say, oh, nope, it's not been 3 hours yet. We feed on demand. So the baby tells us when they're hungry. Again, remember, this is a feedback loop with supply and demand. We have to make our milk, and the only way we make our milk is that it has to be demanded, and we have to have baby have suckle time to increase those prolactin levels and increase production. Now, sometimes the babies may want to eat every 8 to 12 times a day, which, in a 24-hour period, and that's totally normal. If a baby's feeding every 2 hours, moms want to get discouraged and think, oh my gosh, but often it could be during a growth spurt, and the feedings will stretch out as production increases. The duration of feeding typically is about 30 to 40 minutes, which is about 15 to 20 minutes per breast. And I usually tell moms, try to feed on both breasts, and you always want to start where you stop so you don't wind up being lopsided. And you can tell when the baby's getting satisfied because the baby starts to slow down their suckling, the breast becomes soft, the baby looks content, and the baby may fall asleep at breast and release the nipple. But again, if the baby's still kind of slack-jawed on the nipple, don't trust them. Make sure that you do that little release maneuver so we don't have nipple issues. Now, we can have a sleepy baby, and that is frustrating because the mom's thinking, oh my gosh, the baby just nibbled a little bit on one breast, and I know this baby's going to be up in 45 minutes. So here's some things that I tell moms to do. Change the diaper in the middle of the feeding. Okay, maybe it looks like he or she's getting drowsy. Go ahead and change that diaper in the middle of the feeding. That kind of wakes the baby up. Well, I mean, if you have your bare bottomed with air and a cool wipey on it, you'll be awake too, and then the baby will eat better on the second side. Some babies are very, very fussy, so mom may have to do a little bit of soothing. What mom may also have to do is express a little bit of breast milk and put it on the tips of her nipples to make that nipple very, very tasty so that baby's very interested right from the beginning. Some babies are slow weight gain babies, and this can be concerning for both the mom and the healthcare provider. So encouraging the mom to put the baby off into breast to increase her production. And, how do we know the baby's got enough? Well, we don't have a calibration on our breast saying, gee, I produce 4 ounces of milk. We don't have that. So how we're going to judge is the baby's giving us, about 6 to 8 wet diapers a day, and the urine's pale yellow and not concentrated and not stinky smelling urine. Often babies will get what we call breast milk jaundice. Now, this jaundice is a different mechanism than things with your physiological jaundice or your RH incompatibility jaundice or your ABO incompatibility jaundice. It's a different mechanism, and it's not a reason to stop breastfeeding. What it is a reason for is to increase your lactation, because we know that we're going to get rid of that excessive bilirubin through our urine and through our stool, and so we want the baby's GI tract to be well activated to excrete the bilirubin. Preterm babies, it may be a little bit more of a challenge for those moms to get those babies to latch on, but here's a very neat thing about breast milk. Preterm moms, their breast milk adapts itself to the needs of a preterm baby. So the caloric concentration, the digestibility is tailored for the fact that the baby's preterm. So it's a pretty amazing mechanism. Another problem that moms may have is that they have more than one baby. Now, twins, what moms can do is tandem nurse, kind of hold both babies in a football hold. These moms may want to consider supplementing with formula, but moms can successfully breastfeed twins by tandem nursing. It's a lot of work, and boy, is mom going to slim down, because this is really going to put some really good caloric, needs on her to make all of this milk. Some things that moms can do is, if she's planning on going back to work, is to pump and to save her milk. And moms can express that milk by hand expression, which takes a little bit of time, but there are some pumps that mom can use. There's manual pumps that'll help to milk the breast, and then you put it in a clean storage container, and we can, keep it in the refrigerator for 3 to 5 days, in a regular freezer for 3 months, in a deep freeze from 6 to 12 months. I always tell moms to make sure that they label when they express that milk, so they're always using the oldest milk first to keep their supply pretty fresh. We want to make sure they're storing it in clean glass or plastic containers. And when moms are going to reheat, please do not put that in the microwave. What I usually tell them to do is take that milk, get a little bowl or a cup in the sink, and to run some warm water and let that warm water warm up the milk and kind of shake it. Don't microwave it, because it will have a hot spot in the middle, which can actually cause burns to the baby. We don't want to do that. When it comes to weaning, again, that should be led by the preference of mom and the baby. And depending on the age of the baby, the mom can wean directly from the breast to the cup. If it's a younger baby, she can wean from the breast to the bottle. If she can wean that baby from breast to cup, man, that is an awesome thing, because that way she never has to worry about going through another weaning process with weaning from the bottle to a cup. So what about mom and all of this? How's this going to affect mom? Well, the greatest diet ever created. You get to eat and you get to burn an extra 500 calories a day. How awesome is that? So eating healthy, and it doesn't mean that she should eat everything that's not nailed down. Again, a healthy, balanced diet. Go back to looking at your basics of My Plate when you took a nutrition class way back when. And eating healthy, balanced diet, this is going to help her. She's going to need lots of fluids. And one thing that I always tell moms that's really an important thing is, you've got to make sure you stay hydrated. You've got to make sure you have fluid. So if she pours herself, a glass of milk or a glass of water, a glass of juice, and sits it down while she's nursing and kind of sips on it, that's going to help replenish her fluids. And she's going to feel thirsty. Trust me, she's going to feel thirsty. When you look at the weight loss, it is a gradual weight loss with breastfeeding. It isn't like, all of a sudden you can fit into your size 2 jeans in 3 weeks. It's not realistic. It's very good for diabetic moms. It really helps kind of get their blood sugars back under control. And so that's all kinds of pluses when it comes to diet and breastfeeding. As far as activity, just like any postpartum mom, we want them to gradually increase the amount of activity they're doing, not to overdo it. So that's just basic common sense. As far as breast care, well, she may need a little breast shield to help if she has inverted nipples, and those are the nipples that poke inward and not outward, and those she can use during pregnancy to help her nipple poke out. There are breast pads to help catch leaking milk, and you can get the reusable ones where she puts them in the laundry, or they sell boxes of breast pads in the baby care section that she just slips those in her bra and it absorbs any milk leakage. As far as the effect on her menses, a lot of women, as long as they are exclusively breastfeeding, do not get their period back until they wean, which is really cool. So if you don't get a period back for 9, 10, 11, 12 months, this is awesome. But realize that, can you use this as a method of contraception? It's more effective using breastfeeding, if you breastfeed exclusively, as a method of contraception for the first 6 months after the birth of the baby. Then as time goes on, because your normal hormones kind of want to get back into play again. So I would not rely on breastfeeding as a sole source of contraception. Now, if mom happens to get pregnant and she is breastfeeding, yes, she can continue to breastfeed and be pregnant. She just has to realize that she has to make sure she's meeting her nutritional needs, her nursing baby's nutritional needs, and her developing baby's nutritional needs. So she may have to adjust her calories accordingly. Engorgement is one of those things that can happen 3 to 5 days postpartum. And what it is, it's that shift in hormones. It's not that she's so full of milk, it's the shift in hormones just causing some edema to the breast. And typically that relieves itself within that first week postpartum. Some other problems that moms can have, they can have sore nipples. Again, that's from improper latching, improper positioning. So encouraging and demonstrating proper latching, helping the mom with positioning, that will help the mom with sore nipples. So what can she do? She can put cold packs on her nipples if it's uncomfortable. She can use emollients, lubricants, let the nipples air. Again, make sure she's positioning correctly, breaking the suction before pulling off. She can actually even take a little bit of her milk, the hind milk, and put it on her nipples. It's high in fat content and it's bacteriostatic, and it helps protect the integrity of the nipples. Going back to engorgement, if moms are feeling that engorgement, if she empties her breast frequently, she gets in the warm shower, she awakens her sleepy baby, and then, between feeds, you can use some cold packs for about 10 minutes or so. She can put cool raw cabbage, not cooked cabbage, cool raw cabbage on her breasts. It seems to relieve the engorgement. No, I have no earthly clue about why it works, but this is like all good anecdotal evidence that it does work. And that will help with breast engorgement too. And she can use Tylenol and Motrin in moderation. Always realize that what mom takes can go through the breast milk, things like medications, caffeine, smoking, alcohol, and other meds. So mom has to be cognizant of what she's taking in because it can go through the breast milk. Okay, sucking. Does all sucking mean that a baby's hungry? Well, babies suck because it's fun. We can decorate the nursery with all kinds of things. We can decorate the nursery with mobiles and pretty animals, and I think it's more pleasing to us than it is to the baby, because in utero, how do the babies entertain themselves? They sucked. They sucked their fingers, they sucked their toes, they probably sucked their umbilical cord if it flew by. They like to suck. So non-nutritive sucking meets the baby's sucking needs. So it's kind of like a careful balance between, is the baby's caloric needs being met, or are their sucking needs being met? And you'll find that, usually breastfed babies, they get plenty of sucking time because it takes longer to empty a breast than it does to passively get milk from a bottle nipple. So this is really important when we look at our bottle-fed babies, our formula-fed babies, that moms don't look at every time the baby wants to suck their fingers as a cue to stick a bottle in their mouth, because we can wind up overfeeding those babies and putting lots of fat cells down, and that's not a good thing. So we tell them about non-nutritive sucking. So if the baby's sucking their thumb, that's fine. If your 4-year-old is sucking their thumb, that's not fine. That's going to cause teeth problems. So, babies need to suck. So they may suck their thumb, they may suck a couple of fingers, they may put their whole fist in their mouth, or they may suck their passy. And just realize that not all kids like passies. I had 1 out of 3 that liked passies, and then by the time he got to be 4 months of age, and realized that it was bogus, he wasn't interested in it anymore either. The other 2 were like, you're the human pacifier, Mom, so we want you, and we don't want that phony baloney pacifier. But realize that, passies and thumb sucking in young babies is not a problem. It helps to meet their sucking needs and helps you not overfeed your baby. So we're going to look at formula feeding now. Now, babies have the same growth spurts, whether they're formula fed or breastfed, and realize that it takes longer for the baby to digest formula, which is an artificial feeding, compared to breastfeeding. Breastfed babies, it's meant for them. They digest it quickly, so they may get hungry a little bit quicker. When it comes to formula, it really does take about 3 to 4 hours for the babies to digest the nutrients in the formula. So we really don't want moms to feed any sooner than 3 hours. And I've had moms come in for well checkups when the baby's 2 weeks of age, and they're feeding the babies incredible amounts of formula. The baby's 2 weeks of age, and they're feeding the baby 30 to 40 ounces of formula in one day, and I'm thinking, and then they're wondering why the baby's spitting up. Well, I'd spit up too, because the baby's tummy is only about the size of their fist, which is a good teaching point. It's a good analogy. So, we want to make sure that we don't overfeed. Other important things that we want to make sure that we tell the moms is don't prop the bottles, make sure you burp, about every half ounce to 1 ounce or so, because with the bottle, they wind up getting some air in there. If they get air in their tummy, it can cause them to spit up, because that air is kind of acting like a little Heimlich and pushing the formula back up. We want to make sure that they're washing the nipples and bottles in hot soapy water and rinsing thoroughly. And so that's kind of the basics when it goes to kind of handling that. Now, as far as types of formula, there's all kinds of different types. There's different types as far as vendors, there's different types as far as composition. It's really important that we're using iron fortified formula. That's important. And moms are like, oh, it's going to constipate my baby. But think of it this way. Does the iron in a hamburger constipate you? No. Does iron pills constipate you? Yes. So when we concentrate iron formulations, instead of distributing it in food, that's where we're likely to get constipated. It's typically not constipating. It's not the iron that's the problem with the formula. It's the formula itself, because it's the baby's trying to digest, cow milk protein or a soy protein or whatever that causes a little bit of sluggishness in the bowels. So most formulas, if they're commercially available, realize they are a whole lot more expensive than, breastfeeding. Breastfeeding, you feed you, and there you have it. Now with bottle feeding, you still have to feed you, but now you have to expend funds to buy the formula and the equipment that goes along with the formula. There are special formulas for babies with special needs. We're going to talk about like newborn screening, and we kind of alluded to it earlier about newborn screening, looking for inborn errors of metabolism. Not all babies can digest everything that's in the formula, or, even like babies who have galactosemia can't breastfeed, or babies of moms that are HIV positive can't breastfeed. So we have to look at what kind of formula is going to meet their needs. Most babies do fine on just the regular formulas that are cow milk based and iron fortified, but some babies do have formula intolerances where they need to not have the milk sugar, not have the milk protein, or have things that are like pre-digested formulas that are very hypoallergenic for babies that with real bad sensitivities to different types of food. So here's just a little quick down and dirty chart about different preparations of formulas, and realize that the ready to feed is the most expensive out of the prepared formulas. The nice thing is that you don't have to do anything to it. You don't have to add any water, you don't have to do anything to it. The concentrate, you add equal amounts of water to the concentrate, you put it in the bottle and you shake, but realize that with the concentrate and the powder, they can be incorrectly measured, they can be over diluted, and if you over dilute formulas, you can actually cause the babies to really wind up almost like with a water intoxication, and they wind up with sodium issues, and they wind up in the hospital with electrolyte imbalances. So it's real important, if moms are going to use concentrate or powder, and powder is what WIC likes to pay for because it's the least expensive, that they really know how to measure correctly, because otherwise you're going to get too concentrated in calories or too watered down. Also, you want to make sure that when you're using the concentrate or the powder, because it's not ready to use, that the water that they're mixing it with is safe to use, that it's city tap water or bottled water, that their well water has been tested and it's safe to use. So these are important. You can buy bottled nursery water to mix your formula with. That's another thing that they sell in the baby care aisle. Just for giggles, go up and down the baby care aisle and just look at the many baby products that are out there.